Have you ever woken up in the middle of the night with that throbbing pain in your temples? Or perhaps you've been startled to see the numbers on your blood pressure monitor climbing higher and higher while your doctor shakes their head with concern? I know exactly what it's like to live with that constant fear, checking your blood pressure multiple times a day, carrying medication everywhere you go, avoiding moments of joy with your family because you're afraid that the emotion might make your heart work too hard. Hypertension steals more than our health. It steals our peace, our freedom. And the worst part is hearing those same generic recommendations. Cut down on salt, lose weight, take your medications, as if it were that simple, right? After years of helping people like you regain control over their blood pressure, I've discovered that there are solutions your doctors rarely mention. Natural, accessible solutions that really work. In today's video, I'm going to share with you 7 surprising fruits that may actually be raising your blood pressure instead of lowering it, contrary to what most health experts tell you. Imagine being able to gather with your grandchildren without worry, travel without fear of an emergency far from home, or simply wake up without that feeling of heaviness in your chest. This isn't just another empty promise. It's a proven path that you can start today with simple foods and habits that are already within your reach. So stay with me until the end, because this could be the most important video you'll watch this year for your cardiovascular health. Before we begin, I'd love to know if you or someone in your family suffers from high blood pressure. Leave a comment below sharing your experience or any questions you might have about the topic. And don't forget to subscribe to the channel and turn on notifications to receive more content that could transform your health. When we talk about heart-healthy foods, fruits are almost always at the top of the list. And for good reason. Many fruits are packed with potassium, fiber, and antioxidants that can help lower blood pressure and improve overall cardiovascular health. But what if I told you that certain fruits, especially for seniors with existing hypertension or heart conditions, might actually be causing more harm than good? This isn't about eliminating fruit from your diet entirely. That would be terrible advice. Instead, it's about understanding which specific fruits might be problematic for your unique situation and making smarter choices that truly support your heart health. I've spent the last 15 years working with cardiac patients, and I've noticed patterns that rarely make it into mainstream health advice. The truth is that the relationship between food and blood pressure is incredibly complex and highly individualized. What works wonderfully for one person might send another's blood pressure soaring. Today I want to focus on 7 specific fruits that I've seen cause problems for many of my senior patients with hypertension. These aren't bad fruits in general. They're nutritious for most people, but they can be problematic if you're managing high blood pressure, especially if you're over 65. Let's start with the first fruit on our list, canned fruit cocktail. You might be thinking, wait, that's not a single fruit. And you're absolutely right. But this popular convenience food finds its way into many seniors' shopping carts because it's easy, affordable, and seems like a healthy choice. The problem lies in what manufacturers add to keep these fruits looking fresh and tasting sweet. A standard serving of canned fruit cocktail can contain upwards of 18 grams of added sugar, often in the form of high fructose corn syrup. Studies from the American Heart Association have consistently shown that excessive sugar intake directly correlates with increased blood pressure. When you consume these sugary fruits, your body experiences a rapid rise in insulin, which can cause your blood vessels to constrict and your kidneys to retain more sodium and water, leading to elevated blood pressure. Even the varieties labeled in 100% juice often contain concentrated fruit juices that spike blood sugar just as effectively as added sugars. For my patients who love the convenience of canned fruits, I recommend switching to fresh or frozen options without added sweeteners, or choosing canned fruits packed in water rather than syrup or juice. The difference in blood pressure readings can be remarkable within just a few weeks of making this single change. I want to make a pause for a moment to ask something important. When was the last time someone really listened to your concerns about high blood pressure? Not just the numbers from your test, but how you feel living with this condition day after day. Many people tell me privately how isolated they feel, as if no one really understands the constant weight they carry, that silent fear that accompanies every heartbeat. If you identify with this,
I'd really like to hear about your experience in the comments below. It could be something simple like, I've been fighting hypertension for X years, and what afflicts me most is your biggest concern. Sharing your story not only helps me create more relevant content for you, but also shows others watching that they're not alone in this battle. Sometimes knowing that someone is going through the same situation already brings immense relief. And who knows, your experience might be exactly what someone needed to read today to find hope. Now let's continue our conversation about how we can transform this reality together. The second fruit that might be surprising you on this list is grapefruit. Now, grapefruit has long been celebrated as a weight loss superfood and heart-healthy option, rich in vitamins and antioxidants. However, for the millions of Americans taking prescription medications for hypertension, heart disease, or cholesterol, grapefruit can be genuinely dangerous. Grapefruit contains compounds called furanocoumarins that interfere with an enzyme in your intestines responsible for breaking down many medications. When this enzyme can't do its job properly, the levels of certain drugs in your bloodstream can rise to potentially harmful levels. This interaction affects more than 85 different medications, including common blood pressure drugs like calcium channel blockers such as amlodipine or felodipine, and statins like atorvastatin or simvastatin. The effect isn't minor. A single glass of grapefruit juice can increase drug concentration by more than 200%, essentially turning your normal dose into an overdose. What makes this especially tricky is that healthcare providers don't always warn patients about this interaction, and many seniors take multiple medications that might be affected. If grapefruit is a favorite fruit of yours and you're on medication, I strongly recommend speaking with your pharmacist to check for potential interactions. The good news is that other citrus fruits like oranges, tangerines, and lemons generally don't have the same effect and can be enjoyed safely by most people.
The third fruit on our list might come as a real surprise: bananas. Yes, bananas, the very fruit that's commonly recommended for lowering blood pressure due to its high potassium content. While potassium is indeed crucial for blood pressure regulation, too much potassium can be just as dangerous as too little, especially for seniors with kidney problems or those taking certain medications. As we age, our kidneys become less efficient at filtering excess potassium from the blood, a condition that can be worsened by common conditions like diabetes and heart disease. Many blood pressure medications, particularly ACE inhibitors like lisinopril and angiotensin receptor blockers like losartan, as well as potassium-sparing diuretics, can raise potassium levels in the blood. When combined with high potassium foods like bananas, this can lead to a dangerous condition called hyperkalemia, which can cause irregular heartbeats and even heart attacks. I'm not suggesting eliminating bananas completely, but rather being mindful of how many you consume, especially if you're on these medications or have reduced kidney function. Instead of eating bananas daily, consider alternating with lower potassium fruits like berries, apples, and pears. And always discuss your diet with your healthcare provider, particularly after any change in your medication regimen. Our fourth fruit requires careful consideration: dried fruits, particularly raisins, dried cranberries, and dried apricots. These concentrated little morsels may seem like healthy snacks, and they do contain beneficial nutrients and fiber. However, they're also extremely concentrated sources of sugar and calories. What happens when fruits are dried is that all the water is removed, leaving behind a much smaller food that's easy to overeat. Think about it. You might eat 2 or 3 fresh apricots and feel satisfied, but it's easy to mindlessly consume 10 dried apricots, which contain significantly more sugar and calories. For people with hypertension, this sugar concentration can lead to weight gain, increased inflammation, and higher blood pressure readings. Additionally, many commercial dried fruits contain added sugars and preservatives like sulfites, which some research suggests may contribute to inflammation in sensitive individuals. Inflammation is a known contributor to hypertension and heart disease progression. If you enjoy dried fruits, I recommend choosing unsweetened varieties and being very mindful of portion sizes.
A small handful, about 2 tablespoons, is an appropriate serving, not the entire bag. Better yet, opt for fresh fruits whenever possible, as they contain more water, which helps you feel full with fewer calories and less sugar impact.
The sixth fruit on our list is one that might be sitting in your fruit bowl right now: mangoes. These sweet, tropical fruits are delicious and rich in vitamins A and C, but they're also exceptionally high in natural sugars. A single medium mango contains around 45 grams of sugar. That's more than a can of soda. For seniors with diabetes or prediabetes alongside hypertension, a very common combination, mangoes can cause dramatic spikes in blood sugar. These spikes trigger a cascade of inflammatory responses in the body that can damage blood vessels over time and contribute to hypertension. Additionally, the rapid rise and fall of blood sugar can stimulate the sympathetic nervous system, temporarily raising blood pressure and heart rate. This doesn't mean mangoes are inherently unhealthy. They contain beneficial compounds like mangiferin that may actually help regulate blood sugar when consumed in appropriate amounts. The key is moderation and timing. Rather than eating a whole mango at once, consider having a small portion, about 1/3 of a mango, and pairing it with a source of protein like yogurt or a small handful of nuts. This combination helps slow the absorption of sugar into your bloodstream. Also, if you're monitoring your blood pressure at home, you might want to check your readings before and 30 to 60 minutes after eating high-sugar fruits like mangoes to see how your body personally responds. Everyone's physiology is different, and being your own health detective can yield valuable insights that generic recommendations cannot provide. And finally, our seventh fruit to approach with caution: fruit juices, even those labeled 100% juice with no added sugars. Many people mistakenly believe that fruit juice is as healthy as whole fruit, but from a cardiovascular perspective, this is far from the truth. When fruit is juiced, the beneficial fiber is removed while the sugars remain, creating a concentrated sugar solution that your body absorbs very quickly. Even without added sugars, a 12-ounce glass of apple juice contains about 39 grams of natural sugar, roughly the same as a can of cola. For seniors with hypertension, regular consumption of fruit juices can lead to weight gain, increased triglycerides, and elevated blood pressure. The rapid absorption of sugars from juice triggers a greater insulin response than eating whole fruit, and this insulin surge can increase sympathetic nervous system activity, leading to temporary increases in heart rate and blood pressure. Additionally, the lack of fiber means you don't get the same feeling of fullness from juice as you would from eating whole fruit, making it easy to consume excess calories without realizing it. Studies have shown that replacing juice with whole fruit can lead to improved weight management and better blood pressure control. If you enjoy the refreshing taste of fruit juice, consider diluting it with an equal amount of water to reduce the sugar concentration. Or better yet, infuse water with fresh fruit slices for flavor without the sugar impact. Smoothies made with whole fruits, including the fiber, are also a better option than juices, especially when you include some vegetables to further reduce the sugar content.
Now that we've covered these 7 fruits that may be unexpectedly affecting your blood pressure, I want to emphasize that this doesn't mean you should eliminate all fruits from your diet. In fact, a diet rich in whole fruits and vegetables is one of the most powerful tools we have for managing hypertension naturally. The key is making informed choices based on your individual health situation. For example, berries of all kinds, strawberries, blueberries, raspberries, and blackberries, are excellent choices for most people with hypertension. They're relatively low in sugar, high in fiber, and packed with antioxidants that help reduce inflammation and improve blood vessel function. Fresh apples, pears, and plums are also generally good options, as they contain quercetin and other flavonoids that have been shown to help lower blood pressure in multiple studies. If you're taking medications for hypertension or have kidney problems, it's especially important to discuss your diet with your healthcare provider. They can help you understand which fruits are best suited to your specific situation and which might interact with your medications. This personalized approach is far more effective than following generic recommendations that don't take your unique health profile into account. I also want to talk about how to incorporate the right fruits into your diet in ways that support healthy blood pressure. Timing matters. Having fruit as part of a complete meal rather than on its own can help moderate its impact on your blood sugar and insulin levels. For example, having a small apple with a handful of walnuts as a snack provides a better balance of nutrients than the apple alone. Preparation matters too. Cooking fruits can make some nutrients more bioavailable and can reduce the impact on blood sugar. For instance, cooking apples breaks down some of the fiber, but it also enhances the availability of certain phytochemicals that support heart health.
Frozen fruits are an excellent option, especially for berries, which can be expensive when fresh. Frozen fruits are typically picked at peak ripeness and flash frozen, preserving the nutrient content, and they don't contain the added sugars or preservatives found in many canned options. And don't forget about spices. Cinnamon, in particular, has been shown to help regulate blood sugar and may have a modest blood pressure lowering effect. Adding a sprinkle of cinnamon to your apple slices or oatmeal with fruit isn't just delicious. It may offer additional cardiovascular benefits.
Many of my patients are surprised to learn that the DASH diet, which is specifically designed to lower blood pressure, includes 4 to 5 servings of fruit daily. The key is choosing the right fruits in the right amounts. A serving is relatively small, a medium piece of whole fruit, a half cup of cut fruit, or a quarter cup of dried fruit without added sugars. Most of the fruits recommended on the DASH diet are those with a lower glycemic impact and higher fiber content. The diet also emphasizes the importance of looking at your entire dietary pattern, not just individual foods. Fruits are just one component of a heart-healthy eating plan that also includes vegetables, whole grains, lean proteins, and healthy fats. It's the synergy between these food groups that creates the powerful blood pressure-lowering effect observed in studies of the DASH diet. So rather than focusing exclusively on eliminating certain fruits, consider how you can build a more balanced overall approach to eating that includes appropriate fruits along with other nutritious foods. I'd also like to address an important consideration that many conventional doctors miss: the impact of food sensitivities on blood pressure. In my clinical experience, I've observed that some individuals have idiosyncratic responses to certain fruits that can trigger inflammation and raise blood pressure. These aren't true allergies, but rather subtle sensitivities that can be difficult to identify without careful observation. For example, I had a patient who consistently experienced a 10 to 15-point rise in systolic pressure after eating citrus fruits, despite these being generally recommended for cardiovascular health. When she eliminated oranges and grapefruits from her diet, her blood pressure stabilized at a much lower level. This type of individual variation is why it's so important to be your own health advocate and pay attention to how your body responds to different foods. One effective approach is to keep a food and blood pressure journal for a few weeks, noting what you eat and your blood pressure readings 1 to 2 hours afterward. Patterns may emerge that can guide your food choices in a way that generic recommendations cannot. This personalized approach recognizes that each of us has a unique biochemistry, and what works for one person may not work for another. There's also emerging research on chronobiology, the study of how our biological processes follow natural rhythms and its implications for when we eat certain foods. Some studies suggest that consuming higher sugar fruits earlier in the day, when our insulin sensitivity is typically better, may have less impact on blood pressure than having the same foods in the evening. This aligns with the old adage, eat breakfast like a king, lunch like a prince, and dinner like a pauper. For people with hypertension, this might mean enjoying a small serving of higher sugar fruits like mango or pineapple with breakfast when your body is better equipped to process the sugars rather than as an evening snack. While this research is still evolving, it's an interesting consideration that highlights how the timing of our food intake, not just the foods themselves, can influence our cardiovascular health. As with all aspects of natural blood pressure management, small adjustments tailored to your individual circumstances can add up to significant improvements over time.
I'm also frequently asked about supplements derived from fruits that claim to lower blood pressure. Products like grapeseed extract, pomegranate extract, and tart cherry concentrates are widely marketed for their cardiovascular benefits. While some of these do have research supporting their use, it's important to approach them with informed caution. First, supplements are not regulated as strictly as medications, so quality and potency can vary significantly between brands. Second, these concentrated extracts can interact with medications in ways that whole fruits may not. For example, grapeseed extract can enhance the effects of blood thinners and some blood pressure medications,
potentially leading to excessively low blood pressure or bleeding issues. Before adding any fruit-based supplement to your regimen, consult with your healthcare provider to ensure it's appropriate for your specific situation. In most cases, you'll get greater overall health benefits from consuming a variety of whole fruits as part of a balanced diet, rather than relying on isolated compounds in supplement form. The synergistic effect of all the nutrients in whole foods typically provides better outcomes than taking individual components separately. As we approach the conclusion of our discussion, I want to emphasize an often overlooked aspect of managing hypertension: the role of joy and satisfaction in your diet. Rigid restrictions that eliminate all your favorite foods can create stress and resentment, which ironically can raise your blood pressure through psychological pathways. Finding the right balance between healthy choices and enjoyable eating experiences is crucial for long-term success. If you absolutely love one of the fruits we've discussed as potentially problematic, you don't necessarily need to eliminate it completely. Instead, consider making it an occasional treat in an appropriate portion size, perhaps saving it for special occasions or particularly stressful days when the psychological benefit might outweigh the physiological concerns. Remember that no single food choice determines your health outcomes. It's your overall dietary pattern and lifestyle that matter most. Approach these recommendations as helpful guidelines rather than strict rules, and adapt them to fit your preferences and health needs. The most effective diet for managing your blood pressure is one that you can maintain consistently over the long term, not one that makes you feel deprived or restricted. If you've made it this far, you probably know how difficult it is to live with uncontrolled blood pressure. That constant worry, the medications with side effects, the restrictions that seem to steal a little joy from everyday life. I want you to know that you're not alone on this journey. Our channel was born precisely from the desire to create a support community for people like you, who are seeking natural and effective alternatives to care for cardiovascular health. Each week, we share new discoveries, simple recipes that help control pressure naturally, and answer questions that doctors often don't have time to explain during consultations. If this content made sense to you, consider subscribing to the channel and turning on notifications. That way we can walk together on this health journey, one step at a time, without rushing, but with the consistency your heart deserves. I don't promise miracles, but I guarantee honest information based on serious research and the experience of those who have already achieved real results. Take good care of yourself, and I hope to see you in the next video, where we'll continue our conversation about how to live better, even with hypertension. Your heart thanks you for every small care you dedicated today.